Did you know that chronic stress can silently drain your body of vitamin C, leaving your adrenal system overwhelmed and your energy depleted? Could it be that the loss of energy that you're feeling has nothing to do with aging? Could it be that the stress has depleted the C levels or whatever happens? And fortunately for us, world-renowned expert Dr. Thomas Levy, MD, JD, is going to share groundbreaking information about the link of vitamin C and how our immune system works, and especially our adrenals. And it is so important that we take lots of notes today because we have Dr. Thomas Levy. And I know all of you love it when Dr. Thomas Levy is in the classroom because we all learn and grow together. So get your paper, your pencil, because we're going to do something that we always do, which is learn and grow with Dr. Levy.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lillian McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of the Lillian McDermott radio show. If this is the first time in the classroom, please know I've been waiting for you. This is a safe place where we can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening as well as my viewing friend, will feel empowered to embrace inner truth and live the life of your dreams. Well, today, as I mentioned, Dr. Thomas Levy is in the classroom, and we're going to learn not just about our vitamin C, because this was the original topic that I believe Dr. Levy came into the classroom for. And here we are many, many years later. We're talking about vitamin C again because it is such an important topic. Vitamin C, taking vitamin C got me off all my asthma medication. Yeah, sure. Once in a while, I have a little flare up with allergies or whatever is going on in the environment, stress maybe. But for the most part, all I take is vitamin C to help manage not just asthma, but my immune system. So let's hear what Dr. Levy has to say today. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Thomas Levy is here to do just that. Welcome, Dr. Levy, to the classroom.
Hi, Lily. Thanks. Glad to be here.
It's so
You know,
nice to catch up with you, too.
we might have started out with vitamin C years ago, but today is going to be, I would say, vitamin C with some additional nuance.
Okay, that sounds really good. So let's talk about this connection because you always leave it up to me and say, hey, what would you like to talk about? But this time I said to you, which mostly I do, yeah, I do that other times too, what would you like the topic to be? And you did not hesitate. Is this something that is something that you've been researching lately? Because I just saw an article in Orthomolecular Science talk about that and vitamin C and the immune system as well. And so I looked at it thinking that your name would be on it, but it was somebody else.
Well, information and the evolution of information and developing and accumulating information is a process. It just doesn't happen overnight. So much of what I have to say, I'm not going to say I didn't know it years ago, but I didn't have what I considered to have a refined appreciation of where all the parts fit. Okay, so uh, like the title of my new book, for example,
Hmm.
probably out in a month or two, is The Only Cause of Disease. Okay, we've talked about this
The
before.
only cause of
The
disease.
only cause of disease. I
Okay.
mean, making people well can be difficult, but really diagnosing them is not. Okay, and the nature of disease is simple. And that is when I say the only cause of disease is oxidation. That's it. And the only thing that causes oxidation are toxins. Those are not exaggerations, those are not overstatements. And that's what the bulk of the entire book goes through, is documenting that, probably close to 1,500 scientific references, etc. Now, with regard to talking about vitamin C and the immune system, this highlights a very critical part of what I think people, and certainly the physicians, need to appreciate is, first of all, what defines health? What I feel defines health is the cells in the body have normal physiological levels of oxidative stress. In other words, you're always oxidizing, reducing, but when it's at the right balance, you have a healthy cell. When you have too much oxidation, you have a sick cell. And the parameter that determines whether you have a normal level of oxidation versus a pathological elevation is very simple. And that is, does the cell have normal levels of vitamin C in it? If the cell has normal levels of vitamin C in it, you have a normal cell, you have a normal balance of oxidation, and everything else in the body is going to work fine, because we're talking about the cells make up the tissues make up the organs, and that defines health. And now, having said that, then, so this begs the question, if that defines health, and that's what I'm defining health as, is normal levels of vitamin C inside the cell, we talk a lot about inflammation in the immune system. Okay. Now, inflammation is any area with severely increased oxidative stress. And if there's severely increased oxidative stress, there's a severely depleted level of vitamin C. So any tissue or area that's inflamed, by definition, is very, very depleted of vitamin C. One state defines the other. If you severely deplete vitamin C somewhere, that area is inflamed. So they're basically interchangeable terms, okay? Inflammation, focal, means vitamin C deficiency or depletion, and vice versa. So I make the point that the primary, if not the only, purpose of the immune system is to bring inflamed tissues back to normal. Okay, because inflammation really defines, to one degree or another, all pathology. And your immune system is designed to keep you healthy. And if keeping you healthy means cooling off areas of inflammation, it also means one other thing. It means it's bringing the vitamin C levels up inside those inflamed areas, because they will never become normal again until you bring the vitamin C levels up, quench the oxidation, then once again you have a normal tissue. So the point I would make to you is that the primary, if not only, purpose of the immune system is to cool off and normalize areas of inflammation, which then leads to another point, which is vitamin C delivery. All right. Now, when you have an area of inflammation, and we see this model when we're looking at coronary artery disease in the heart, when you have an area of inflammation in the tissue, that sets off what's called an acute immune response. So, I mean, the immune system is being notified that there's an area of inflammation, depleted of vitamin C, and it needs to go in there and do whatever the immune system needs to do to cool off that inflammation and bring the vitamin C levels back up to normal. And if it does that, it resolves the situation. Now, we've identified, when we're talking about coronary artery disease and the inflammation of the arterial wall, the first immune cell, the first one that shows up to the site of inflammation when you have an acute immune response, is the monocyte. What's the monocyte? The monocyte is a white blood cell that has astronomical levels of vitamin C, magnesium, and hydrogen peroxide inside. So literally, the first cell that the immune system sends to an area of inflammation is the immune cell that has the highest level, very high levels, 80-fold more than the plasma, inside the inflamed area. So effectively, the acute immune response is striving to respond to the inflammation by bringing vitamin C into the area of inflammation and cooling off the inflammation. And if you don't have any further insult, that resolves it. But when you're dealing with inflammation due to, which is often the case, chronic pathogen colonization, then the immune system just continues to come in, brings in fibroblasts, and in the case of the coronary artery, starts building plaque. Now, my proposition then to anyone listening to this is that the sole, or almost the sole, purpose of the immune system is to supply vitamin C where it's deficient. Because I just told you, when vitamin C levels are normal, you have normal tissue. And ultimately, the purpose of your immune system is to restore tissues to normal. And they cannot be restored to normal unless and until you restore normal levels of vitamin C to those tissues. So let me make one more outlandish statement.
Yeah, because I've got some questions for you. Go ahead.
Vitamin C is the immune system. Now, they have textbooks that are a mile thick with all sort of abbreviations, this, that, and the other, and immunology, blah, blah, blah. And I'm not demeaning any of that. That's all good research. It all shows a lot of things. But still, after the fog clears, after the dust rises, it all is designed to bring areas of inflammation back to normal, which cannot be achieved until you get vitamin C levels normal in those tissues. Now, there's other things you could do that alleviate it. You eliminate the infection. But the bottom line is normal vitamin C levels mean normal cells, and the immune system works primarily, if not entirely, to bring vitamin C levels back to normal.
Okay, so you've used the word normal multiple times. I think I lost count. I stopped counting after 4. And so when you say normal, how do you measure normal? No inflammation?
Actually, yeah, it's a retrospective way to do it. If you cool off the inflammation completely, you have normalized the vitamin C level. The thing is you have calcium, magnesium, vitamin C, glutathione, and ATP. Those are the 5 big molecules inside your cells, the interaction of which determines if you have oxidative stress at all, or if you have a little bit of oxidative stress, you have a lot of oxidative stress. You probably recall from our previous talks that calcium is the nasty one. I mean, until you get calcium down, you cannot relieve the oxidative stress inside the cell, and you cannot get enough vitamin C inside the cell as long as the calcium level stays up. But then you bring in the magnesium, bring the calcium down, bring the magnesium level up, then the cell is open, shall we say, receptive to the other mechanisms we have to bring vitamin C inside the cell. Now, here's the other thing that just ties this in perfectly is when we talk about natural corticosteroid function. Now, when I'm talking about natural corticosteroids, I'm primarily talking about cortisol, which is in a prescription form, it's called hydrocortisone. Same thing. But I want to emphasize at the outset that I am not talking about the common synthetic corticosteroid prescription sledgehammers like prednisone, methylprednisolone, dexamethasone. These are all just incredibly overpowerful agents that screw up more than they help. So let's go back now to the hydrocortisone, the cortisol. I always talk about the importance to balance hormone function, and I've mentioned for some time now the primary things that you need to get normal to deal with oxidative stress throughout your body are normal levels of sex hormone, normal levels of thyroid hormone, and normal levels of cortisol. Cortisol is especially important because, as it turns out, and we have the data to show it, the primary purpose of hydrocortisone or cortisol is to push vitamin C inside the cell. That's why cortisol is an anti-inflammatory drug, is because it's pushing the ultimate anti-inflammatory inside the cell. If there's very little to no significant extracellular vitamin C sitting around waiting to be ushered inside the cell, the cortisol and all the other corticosteroids do nothing but harm by a lot of other conditions. But when you take physiological amounts of cortisol, because Unfortunately, most people are adrenal insufficient, just like so many people are thyroid insufficient and sex hormone insufficient. When you take just the right amount of hydrocortisone, along with appropriately dosed vitamin C, all I can tell you is clinically magic starts to happen. Now, we also know that this is true because of the genetic defect that humans have. And I think you're aware of this. We've talked before that regular animals can make their own vitamin C. The human being has a 4-enzyme sequence and they deficient in the 4th enzyme, an epigenetic defect, can't make vitamin C. But what happens when you have the acute stress response, the fight or flight, a brand new infection, a big toxin comes in? What happens inside the human body? Inside the human body is you release a ton of cortisol from the adrenal gland, and that cortisol is hoping that the liver will start making a lot of vitamin C to meet in the blood, and the cortisol pushes the vitamin C inside the cells. But that only occurs in the animals. In the human beings, we lost that enzyme, so negative things happen. What do I mean by that? It takes glucose to make vitamin C. So when we're missing this enzyme and we have a big stimulus like that, all we end up doing is building up glucose. And this is why so many people get diabetes. Diabetes, in every sense of the word, is, if not a genetic disease, directly secondary to a genetic defect, which is this inability to make vitamin C. But when it all works together, that's why things work so well. Let's say you repair this, and we might talk about that. There do appear to be ways now to repair this. When you repair this and you take a little bit of hydrocortisone with your first morning dose of vitamin C, you really set the day up well.
Okay, so so there's just so much. You're talking about hydrocortisone with your first dose of vitamin C, which I didn't realize you needed to take those two together. Is that a new thing that you've discovered? Because I remember going on hydrocortisone a while ago, but I wasn't taking it with vitamin C.
Well, I mean, yeah, you can call it new. I mean, I think the physiology is as old as mankind, but we're only figuring out now how everything interacts.
Yeah.
But yes, that's why, okay, unless you're an extremely unhealthy person, very poor diet, no supplementation, and you take a dose of hydrocortisone when you have like an achy joint or something, pretty much nothing happens. Whereas most people, whether they supplement or not, but they're eating a fair diet, and you have a joint pain, take hydrocortisone or another corticosteroid, whoa, it feels better. Well, what happened? You took all the extracellular vitamin C and pushed it inside the cells. But that's not going to be a long-lasting effect
No.
unless you realize what's going on and start regularly taking the vitamin C as well, so it has something to push inside the cells.
Yeah, yeah. So that's good to know that it's the first dose of hydrocortisone
Well,
in
that's
the
important too. Let me explain that.
yeah.
Cortisol that your adrenals naturally make, your highest levels are first thing in the morning that your adrenal glands make. And then it progressively declines until you're making almost no cortisol when you're getting ready to go to bed at that night. That's another reason why you never take hydrocortisone late in the afternoon or early in the evening, because you will get insomnia. But first thing in the morning, all you do is bolster a natural response, because even if you did the testing and found out that you have quote unquote normal levels of cortisol first thing in the morning, that still doesn't show that you have a normal adrenal response to extra stress. Because when you have extra stress, you're dealing with maybe a new infection in your nose and throat, then, I mean, you can take large doses of vitamin C and a very large dose of hydrocortisone to kickstart against that. But the thing, let me also add this. This is hormone replacement therapy. This is not hormone treatment. This is not you're treating a hormone deficiency. Okay, you're not just saying, well, hormones help this, let me give a whole lot of hormone to that. What you're doing is you're replacing a deficiency, which is why when you do it correctly, there's zero chance of side effects. There's no, I mean, just like they have doctors paralyzed, even the open-minded ones, as to, oh, you can't give 50 or 100 grams of vitamin C. They're just as paralyzed about giving any form of a corticosteroid for more than a few days in a row. But again, I'm talking about the corticosteroid that your adrenal glands naturally make, that you need in your body every day, not prednisone, not decadron, not dexamethasone or methylprednisolone, which are all, I like to call them, physiological sledgehammers. I mean, the cortisol just gently takes care of things. The prednisone just comes in like a giant rock falling on the road.
Okay, so that's all great information, but not all men are created equal. Not all women are created equal. So for me to maintain a healthy balance of low inflammation in my body, I take about 10,000 milligrams orally. Now I know that I can take 100,000 milligrams IV wise and get all of it, and it just supports my body. Especially people with cancer, they seem to thrive on that. But what is the normal? Because I know that when I take oral, that 10,000, I might absorb half of it or even a third of it.
Well, guess what, Lily?
What?
Glad you brought that point up because this makes the oral dosing much, much easier. Why? It's because cortisol induces vitamin C transporter proteins across the cell membrane.
Okay.
So if you take the cortisol, which is what you should do, an hour or so, or at least a half an hour or so before, because it reaches peak blood level about an hour after you take an oral dose. So if you take them close together and they're both getting in the blood at the same time, you absorb a much greater percentage of the vitamin C in your gut. And that'll be your quickest check. I mean, since I've discovered this, I've taken doses that are 3 or 4 times what I've considered to be my bowel tolerance in the past without any problem at all. So I mean, really gets absorbed. It really gets absorbed because you're inducing, just like all the other cells in the body, part of the absorption of vitamin C inside the gut wall is to first get inside the intestinal cells before it comes out the other side. And for that, you need vitamin C transporters across those cell membranes. Without the cortisol, when you take it, it literally binds up a protein inside the cell, and that goes to the nucleus, and then the nucleus codes for the production of more transporter proteins that then come back out, lay across the cell wall, and allow the vitamin C to come in.
Okay, so when you're talking about the last time we talked about the mitochondria and how the way the ATP has to happen and then the mitochondria, does this feed the mitochondria? Does it have anything to do with the mitochondria when you're using the cortisol and the vitamin C at the same time?
Well,
Where
you see, the cortisol, the electron transport chain in the mitochondria that allows you to make ATP requires electron donation, and that's what vitamin C does.
Okay.
So when you start normalizing vitamin C in your cell, you will also rapidly normalize or near normalize ATP production inside the cell, especially if you're not primarily deficient in the precursors in the electron transport chain. If you're not deficient in niacinamide, deficient in riboflavin, deficient in coenzyme Q10, so all of that is lined up and ready to go, then normal levels of vitamin C, because I mean, there's not a wall between the mitochondria are floating around in the cytoplasm. So I mean, and the vitamin C gets in there just like it gets everywhere else. So having the normal levels, and I mean, it's a yin and yang thing. If you're having a tough time getting your vitamin C levels up, but you're taking good supplementation that's supporting better than usual ATP formation, then that ATP will also work to help normalize the vitamin C. They work both ways.
So how do you test the vitamin C? I mean, you get a blood test.
It's empiric. No, I mean, you don't have a blood test to test. I mean, we do have some studies that we did at the Reardon Clinic that did show we were able to increase substantially the intracellular level of vitamin C inside lymphocytes by the addition of hydrocortisone. I think both were done intravenously, but it still works out orally or intravenously. But no, there's not a lot of work on this. I mean, but no, there's not a blood test that says, "Oh, your vitamin C level now is perfectly normal inside your cell." No, no, we don't have that.
So basically, you'll know it's normal with how you feel. So how much
How you
hydrocortisone?
feel and normalization of abnormal blood tests.
Okay, so what is the normal blood test? What are you looking at? What kind of test is it that you're looking for normal?
Well, I mean, if you're dealing with somebody that has a disease, everybody has different abnormalities and different things
Okay,
unique.
okay.
Yeah, yeah,
Yeah,
unique to a certain disease process. Sure.
yeah, where I'm getting at is, is there a test that you take that you before you start, you realize things are out of balance, out of whack. You start taking the hydrocortisol and you're taking the vitamin C, and then you take this test again, and then it's normal. So there, that test doesn't exist.
No,
You're
no, no,
looking
no.
at, let's say, if you have a condition.
But there are tests that will tell you a lot, maybe more than others, like all the different inflammatory markers.
Okay,
There's a
so
whole bunch of
what
them,
is that test called for
but
the
but
inflammatory?
but probably the most significant one that's been has the greatest use and the greatest track record is CRP,
Hmm.
C-reactive protein.
Okay.
So, if you have a elevated CRP or high in the quote unquote normal range, people in the high level normal range of CRP are too elevated already, believe me. They just have to arrange the normal range so they don't make the entire population abnormal. So
Yeah.
generally speaking, you want a CRP from like 0 to 5. All right. Uh, I've never seen a 0, but I've seen a bunch of zero point 0.2 and zero point 0.3, and that's what you want. You don't
Wow.
want a four. You don't want a 4.5 or higher.
Yeah, I was at 4.0,
Okay,
and
not
my
bad, but not excellent.
well, I have to tell you, this was from my urogynecologist at the time, and I maybe it was 3.5. I don't know what it was, but she said this is the lowest I've ever seen. Lowest. So I left there kind of pumped up.
There you go.
But the thing is that most people, and as a matter of fact, we just entertained a couple that they were at a 7 or so, and they were trying to get it down. And so this is like a
Not to be
indication.
melodramatic, but that's heart attack city, is what that is.
Um, but uh, is this the higher the number, the higher the inflammation in the body, that leads to diabetes? Would that lead to diabetes or other autoimmune conditions?
At least all diseases. I mean, it's an index of inflammation throughout your body.
Mhm,
Certainly, you could have one area of your body with a certain focal condition or infection that's contributing much more
mhm.
to the generalized oxidative stress being measured. Uh, so, I mean, diabetes, for example, would be something that I've never seen a study on this per se, but probably should be pretty consistently high CRP because it's affecting the entire body. It's a metabolic disease. It's affecting every cell in the body. It's not like, well, I got a liver disease or I got kidney disease or I have thyroid disease, where certain cell populations
Mhm.
are releasing and causing a lot of inflammation that will affect your CRP. So no, it all depends.
Okay, so with that in mind, would one say get your CRP test to start with, just check it out. And then how much time? Because I will tell you, I have been on methylene blue. You know what my like I resisted the methylene blue for years and years until just recently when you said to me when you told me that I needed to get on it, and I said, well, I would if they had a pill form, and you said, well, they do. You tricked me. You tricked me. But you know what? When I put the pills on my tongue, I get little blue spots. So but so now I just t put it and I drink the water real quick so I can minimize the blue on my tongue. It goes away really quickly. I know.
Such a drama queen.
Well, so, but anyway, I've noticed after 4 months, I'm not reacting to things as much. I just spent an evening with some friends who has a big, a big dog, and I was fine. Normally, I would have had to increase my vitamin C. I would have had to, kind of like, maybe do some nebulizing treatments, and it would have been, I mean, maybe a whole production. But because I am allergic to that fur, that dander of the dog, but I did not even react. I had a great time, and I'm wondering how much the methylene blue, along with the riboflavin, along with the B3, along with the CoQ10 and the
Mhm.
K2 and all that, magnesium, all the stuff that you have me on. I wonder of how much of that, along with the vitamin C that I take, has kind of started in a pattern where I'm seeing that I'm not even reacting to it. Is that what happens?
Absolutely.
So,
I don't have any problems completing that.
so okay, so when I think of that, I hear a lot of people, these are some of the myths. Let's just go there. Some of the myths that I've been told over the years, because it was Dr. Andrew Saul who got me away from my asthma medication. May he rest in peace. And he was the one that told me that at minimum that I would need to take 10,000 milligrams minimum if I wanted to get over, because I was on heavy duty asthma medication, heavy duty, Xolair being one for 9 years. And that's
Oh,
an immune suppressant. That's suppressing the immune system. And when you suppress your immune system, guess what? All these diseases kind of like hit you. So I attribute my health to the classroom. I am so grateful to all the teachers that have been in the classroom. So when I started taking the vitamin C and I stopped with the autoimmune, the immune suppressors and all those things, it's been a journey for me.
mhm.
I believe that the methylene blue and all the different the what do you call it? The fabulous eight or the top eight or the
Super 8.
super eight.
Super 8.
Okay. Yeah. The super eight that you talk about, that has helped push it. Is it that with the vitamin C that has helped? Or because I'm not taking cortisol at this point, hydrocortisone, now. I'm not taking it anymore. If I were to add that, what would be the dose and how much would you start with?
I mean, it's perfectly willing, perfectly fine to experiment with 20 milligrams or less. So you can try 5 milligram, 10 milligram, 15, 20 with your first morning dose of vitamin C. Let me say this, and uh, I can't give a scientific explanation as we might like, but the effect that cortisol has on oral vitamin C is much more striking with ascorbic acid rather than sodium ascorbate. So if you're doing this with the cortisol, I would definitely go with the ascorbic acid. Unless you
Okay.
just have a horribly delicate stomach, which I don't think most people do, but some people can have problems with anything. So I mean, if you have if you have an upset stomach, well then go to the sodium ascorbate. But if there's not a problem taking either one, the ascorbic acid, I think the ascorbic acid dissociates much more completely than the sodium ascorbate, and so you have more ascorbate radical ready to interact
Okay.
with the cortisol. But I'm not going to the bank with that. I'm just giving you a little speculation. But it has been a pretty clear observation by myself and a colleague. Okay, similar situations of those two together achieving a clinical result that we weren't seeing otherwise. And a lot of non-specific stuff,
Okay.
you get older, hip pain, leg pain, all that stuff, so it can magically disappear if you get your vitamin C right.
How much time? And once you start taking the cortisol, you just start looking at that CRP again. See, how long does it take for the body to kind of start releasing that control of stress or stressors that, it's like, okay, now I can let go. Now I'm being nourished. I'm now getting what I need.
Well, if you have a pain that's secondary to a site of inflammation and the pain goes away, all right, the inflammation is pretty much going away. And I wouldn't imagine it'd take more than a day or two for the CRP to show its
No
actionable
way,
drop.
really? But isn't
Yeah.
that like the measure of a month?
No, no, I don't think so. No.
That's what I thought. I thought that a CRP kind of like combined all the levels of you know me, I'm not an expert. I just play one on TV. And I did sleep at a Holiday Inn Express. So,
Okay. Well, you'll have me checking, but I don't think the CRP. If you alleviate the inflammation triggering the CRP, I don't think it's going to hang around that long.
okay.
Now,
That's
it's
good to
not
know.
long 24 hours or 48 hours or 72 hours. I'm not sure, but I would think for sure, personally, without researching it right now, that 72 would probably do the trick.
Okay, well, that's good. And then also, most people that are having this done and there's inflammation in the body, because I do know that the CRP is, that's when you look at with if somebody's going to be pre-diabetic or if there's somebody's looking at that, right? Isn't that the main reason or just inflammation in the body overall?
Well, remember what we said what inflammation is. Inflammation is vitamin C deficiency, okay?
Wow.
And inflammation is going to be the precursor for disease of any type, any disease in the body, okay? So it's general in one sense, but the fact of the matter is, it still reflects by the mechanism we just talked about the fact that you're vitamin C deficient in the wrong places.
Okay. So before I start talking about the myths, because I kind of alluded that I was going to be talking about the myths, I want to just like shift gears a little bit and I want to remind everybody that this man is going to be speaking at the I Am the Solution Natural Health Summit. I am so excited. Unfortunately, he will not be there live. I wish I could like pull him over and have him come because everybody loves talking to Dr. Levy. It's like royalty has entered the building, like Elvis, basically. And so, but just know that these are conversations that we're going to have at the I Am the Solution Natural Health Summit for cancer and autoimmune dis-ease. And these are conversations so that we can start taking our health back, be our own MD, our own medical detective. And we're going to put the pieces together because everybody is different. Not what works for me may not work for you. Although Dr. Levy I did think I heard him say that this is the end all be all, the hydrocortisone and the vitamin C together to help push that vitamin C into the body and therefore reducing inflammation, which is what causes disease, which
Which
brilliant,
is disease.
brilliant,
Is
which
disease.
is disease, that capital IS. Okay. So this is, you heard it from here first because I don't know if anybody is talking like this, but I certainly, I know that when you eat a certain way and you know that your body, your joints are hurting, or there's inflammation, or we know our ring size changes, things like that. We know that we're facing inflammation. So I want you to mark this date down, mark November 1st, 2025, in Rockledge, Florida. We are going to be coming together, the community, all of you, come from wherever you want to come from, because we're going to be experiencing the joy of like-mindedness, people that are curious instead of critical. They want to work on their body as natural. I mean, can you imagine taking a tiny, cheap little hydrocortisone pill and vitamin C, which is also cheap.
But unfortunately, the hydrocortisone is prescription.
Absolutely.
Right.
A- Absolutely. Okay,
Right.
so prescription drugs. So with that in mind, I want to encourage you to go to whenyouneedafriend.com. The link to the event is below, so you can click on it, get your tickets, get your passes, and I want to encourage you to bring your friends, your family, because families that research together and grow together heal together. And this is so important that we all come together. It was a long time ago that all we did was, because of the pandemic, we couldn't even be like 6 feet apart. We had to be 6 feet apart, but not anymore. Now we're going to hug and kiss each other. And sometimes I look people in the face, but that's something that happens whenever you least expect it. And so those are just things to look forward to. We're going to have great vendors, great speakers, including Dr. Thomas Levy. So please mark your calendar November 1st and plan to attend with us. You can also go to whenyouneedafriend.com. If you don't see the description, go to whenyouneedafriend.com. There will be a pop-up where you can just click on it. It will take you there, and then you can research what we're going to be discussing, who's going to be there. And I am excited that God is forming the most amazing team of speakers, vendors, and you'll be able to try everything, like try hydrogen therapy. You'll be able to, and everybody that came the last 2 years with Dr. Levy talking, everybody left and ran to the store to get some nebulizer so that they can start nebulizing hydrogen peroxide. So there's so many things that when you know better, you do better. So go to whenyouneedafriend.com. While you're there, please subscribe to the channel, like and follow me on all social media, including the podcast and BitChute and all those different places that we normally don't even think about. Then go to check out my sponsors, support my sponsors the way that they're supporting the classroom. And then you can go to my Shop Now page where you can help grow the classroom. There's products there that are Lilly approved from head to toe, from makeup to pain management. Go figure. So easy to just click on it and start doing your own research and see what works for you. And then last but not least, you can become an enrolled student in the classroom. So whether it's $1 or $1,000 a month, a one-time donation, whatever you can give, whether it's your time, your talent, your treasure, that will all be appreciated. Sharing this video, putting emojis, making comments, that will help. And I don't care if you're watching later on, you can still put a comment, and I can always forward that information to Dr. Thomas Levy. So Dr. Levy is someone that is one of my favorite people in the world. He comes into the classroom, he always razzle-dazzles us and shares new truths to all who are open to learn these truths. You can also go to Dr. Thomas Levy's website. It's tomlevymd.com. That's TOMLEVYMD.com. You'll find a lot of information there. I know that your new book is called The Only Cause of Disease, or what was it? That's the name of it? That's the name of the book. The Only Cause of the Only, you hear it here, only cause of disease. So when will that book be ready to go?
Everything should be complete in a month. Now, how long, once we have everything sitting there, the publisher takes to get the books out? I suspect another month after that, so maybe 2 months from now.
And this is a hardcover book? It's not the PDF?
It's both. It's both. It's available both ways.
Okay, well, this is great. Congratulations. I know that before you know it, it'll be ready, and maybe we can have some copies of your book at the I Am the Solution Natural Health Summit.
Okay.
Just thinking ahead. Okay, so I want to talk about myths. I've alluded to it a couple times. One of the things that I have been told over the last, I don't know how many years, well, since 2013, that I can get an overdose. I can overdose with vitamin C, and that people have died from vitamin C. Can you share a little bit more about how that is impossible?
Well, the first thing that comes to mind is vitamin C is the single most critical molecule in your body for normal and optimal function of your cells. So it's not some foreign agent, it's not a prescription drug. That combined with the fact that all of the toxicity studies has never shown a toxic level of vitamin C to exist for the human being. They found some toxicity studies in animals that would convert to taking 800 or 900 or 1,000 grams of vitamin C in a human being, but I don't know how somebody could take that much anyway. The point being, though, is that I maintain that vitamin C is the single safest substance for you to ingest. And I always mention when I'm questioned about this, and in my book and in my writings, that you can give psychiatric patients have done this. You can give them, or not give them, they will take and swallow a couple gallons of water in 10, 15, 20 minutes, and then go into cerebral edema and die with seizures, basically water toxicity. So there we have an example that water can kill, and all you do is drink water, all right? I don't think that could happen with vitamin C. So now when you're talking about IVs and there's other things added to the IVs and you're looking at different situations, or maybe somebody's having a detox reaction, well, those still have nothing to do primarily with the vitamin C having any intrinsic toxicity.
No, I agree. I agree. Well, but here's the thing. Doctors prescribe pain medication that causes addiction. It could cause death if taken the wrong way, but yet nobody ever worries about that. Nobody says, "Oh, you're going to get, if you start taking these pain medications, you can get, you can become addicted or even die." But then and I remember Dr. Andrew Saul coming on the show saying, and there's never been a death with vitamin C. But if you start taking vitamin C and all of a sudden you get off your pain medications or you get off your asthma medication or you get off all these other medications, then somebody's going to be upset. Somebody's going to be upset. And we know who that thing is. So I just want people to understand that that is not something to worry about with the vitamin C.
Well, you
We
bring
take
up a
it to
good point.
Okay, go ahead.
There's a statistic out there that at least 100,000 people a year die in the United States, not only from prescription drugs, but for prescription drugs properly prescribed.
Correct.
All right, no question of overdose, just reaction to the drug, death.
Yeah, absolutely. And nobody ever bats a lash on that one.
And
People,
this
they
brings
still
up
take
the
it.
basic principles of orthomolecular medicine. Ortho meaning correct, molecular meaning molecule, and the whole premise of orthomolecular medicine is the fact that virtually all disease is due to deficiencies of one or more natural substances. And until you identify those deficiencies and restore them, you're not going to get a whole lot better. But the point is you have vitamin C deficiencies, you have niacin deficiencies, you have magnesium deficiencies, and they respond dramatically to restoration of their levels. You don't have prescription drug deficiencies.
Or chemotherapy deficiency or
chemotherapy
radiation.
use.
Yeah.
So,
Yeah. Yeah. Okay. So then the next thing I want to address is bowel tolerance. So how do you take vitamin C? How do you know you've taken enough vitamin C? And if you can share about bowel tolerance and the proper way of taking vitamin C.
Well, regular vitamin C, of course, you realize the liposome encapsulated vitamin C from Lillian Labs you can take, and there's no bowel tolerance issue at all. Okay, but that's a little pricier than regular vitamin C, and some people might want to go more economic, but also put greater effort into it. Because in order to dose regular vitamin C, you need to take it a few times a day, not just a one-time dose in the morning. Now, we mentioned earlier that when you don't completely absorb, assimilate, and take up the vitamin C from the gut, and the sensitivity is different in different people. Some people will react like this to a gram, others won't react until they get to 10 or 15 grams, but different people will then collect the vitamin C in the colon, and it's very osmotic, pulls in fluid, and causes what's called a C flush, or a osmotic diarrhea from the vitamin C. Now, early on, there's no predicting when that is. So if you're doing it for the first time, you just, pick a dose, 1 or 2 grams, take that every hour, hour and a half, and see what type of dose range you go into before you start to get a little bit of gas or cramping or a little bit of a loose stool. And like I said, there's no set amount for people that some are going to be a very small dose, in which case they'll almost be forced to go with something like the Lipo C, or otherwise they won't get enough vitamin C in their body. To others that have 10, 15, 20, and they have some reports of people, usually with advanced chronic disease, consuming lots of vitamin C in the body, they can't get a bowel tolerance. They'll take 30, 40, 50 grams and never get the loose stool. So there's the whole range of gut sensitivities, and each person has to work out for themselves what basically their bowel tolerance dose is. Let's say it's 16 grams or 15 grams, and then you start to get loose. Well, assuming you're not acutely ill and you need to take more, then you divide that by 4, and you take, rather than 4 grams 4 times a day, you take a little bit less, take 3 grams 4 times a day, so settle for 12 grams, and then that all gets absorbed and doesn't cause the bowel irritation. And I want to emphasize this too. This is not a toxic effect, okay? Lots of people call it's a side effect, so it's toxicity. No, it's just a natural result of having something in your bowel that's pulling in fluid and causing an outrushing. It's not a toxicity like something being poisoned or oxidized or something like that. So there's side effects and there's side effects, let's put it that way.
Well, I always say that if I had to choose my side effects of, taking a pill even correctly and it caused death, I would rather choose diarrhea over death. I mean, I don't know about you, but to me,
Well, other people too that aren't familiar with this, Lily, should understand maybe diarrhea is a bad way of referring to it, because
loose stools,
people think of diarrhea with infectious disorders and they're just sitting on the pot all day long.
no.
No, you push a little forward, you have couple flushes, and then you're through.
Yes, yes.
Right.
Yeah. And so that's one of the things. And then, we just need to get to know our body. So the main point here that I would like to nail is the fact that we do not produce our own vitamin C. What do you say to people that drink orange juice or eat a particular fruit that has vitamin C, maybe even peppers or whatever? How does that compare to taking the extra supplements?
Minuscule amounts of vitamin C. I mean, I'm not trying to say don't eat healthy foods, because those are all healthy foods, but don't delude yourself into thinking that there's any amount of quality food that you can take that will remotely give you an adequate amount of vitamin C on a daily basis.
Mhm. So
And people say, well, that's not natural. Well, it's not natural that we have a genetic defect in our liver.
yeah.
So it's an inherited genetic defect. Some people can overcome it, others can't. But the point is uh, you need supplemental levels of vitamin C, and there's no amount of vitamin C in any diet that's going to satisfy the complete needs that you have for vitamin
Yeah.
C. It'll
Yeah.
help, but
Yeah.
it won't satisfy the complete need.
Yeah. Yeah. So what do you say to people that are on suppressors, the immune suppressors, and like what Xolair was, is an immune, it's a chemotherapy, but drugs that you're not allowed to take vitamin C with.
But and I go in this, I don't know whether I have enough time to go into a big detail, except to say that it's bad to call it immune suppression,
Mhm.
okay? Because, and I don't know exactly why the corticosteroids uh, help suppress rejection, except to say there's a load of studies in the literature that show vitamin C, which is what? The primary thing that your immune system should be delivering, decreases the chance of rejection in heart transplants and kidney transplants, in bone marrow transplants. So we've been laboring under a fiction for a long time, insofar as the fact that rejection is increased oxidative stress in different areas of the transplanted organ or tissue, and higher doses of vitamin C, not prescription strength corticosteroids, is the way to go.
Well, I want to add here that you're not telling anyone to not take anything. You're not being a doctor to anyone or giving them advice. You're just sharing information. So everybody has to be prudent and do their own research. Be your own MD, your own medical detective, and check this with your doctor, especially if you're taking drugs where they've told you not to take vitamin C, which it just like, I just want to fall over and go, what? Why would you buy into this? Why would you not want to take something? Well, if I take it, then it's gonna, I'm gonna lose my kidney, or I'm gonna lose, the effectiveness of this drug. Well, maybe you don't need this drug. Maybe all you need is vitamin C. I mean, so I would say, get a good doctor that could maybe work with you if you do want to get off medications. I wanted to get off asthma medication. I think I'm alive today because Dr. Andrew Saul got me off of that medication, that for asthma. And, I don't know if it's given any side effects for me. All I know is that I'm just grateful to not just him, but you and all doctors and teachers that have come in the classroom, because, you know,
Your
we
only
just
side
need to
effect is being
rewrite.
healthy and looking young, Lily.
The what
Your only side effect is being healthy and looking young.
is looking young and being happy, right?
There you go.
And
You
so
can't be happy if you're sick. I got news for you.
I know.
Doesn't happen.
That proverb goes, a healthy person has 1,000 dreams and a sick person only has one, which is to get better. And so I'm grateful that you're planting seeds today, and that that you continue to do this. Your passion is always so contagious when it comes to health and wellness. So thank you so much, Dr. Levy, for being in the classroom.
My pleasure, Lily.
Yes, and please remember, you can go to tomlevymd.com. You can ask your questions below. I'll send them to Dr. Levy, or I'll ask him to go on there and check them out. But there's just, when you know better, you do better. And so I want to encourage all of you to take the myth and the fear of vitamin C and realize that our bodies need it. We need it. Somewhere along the way, somebody must have figured out a way to bypass and cut that vitamin C effectiveness from our body by deleting it or giving us a pill that doesn't help us produce it anymore. So thanks for letting us know how to not only take vitamin C, but turbocharge it. So thank you so much, Dr. Levy. And please remember, we'll be right here waiting for you worldwide at whenyounneedafriend.com. This is Lily McDermott and Dr. Thomas Levy wishing you love, peace, joy, and unexpected abundance. Make it the best day ever.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.